Hello, everybody. I am Dr. Steve Johnson. I'm going to welcome you to my YouTube channel, Psychotherapy Education and Training. And today, the live stream, I will be covering integrating ReBT and seeking safety for the treatment of PTSD and addiction. Both excellent models for doing that. Before we begin, I want to mention that at any point in the presentation, the webinar, if you have any question, just make a comment, and I will read that as I am able. Okay. Also, I want to give a shout out to the latest member of the YouTube channel, Millie, and just thank you. And I want to thank all the other individuals who have joined this, the members only group. And I'll explain at the end what that means and the kinds of services that you get for doing that. Okay, so let's begin the presentation. And as I said, I'm going to be looking at how do we go about integrating Rational Emotive Behavioral Therapy, ReBT, and seeking safety. If you haven't encountered seeking safety, I'll mention a little bit about what it is in a few minutes, but it is an evidence-based treatment for both PTSD and addiction. That's rare to find one model that does treats both conditions, but that model has high research support as listed by the APA, American Psychological Association, Division 12, that looks at evidence-based treatment. So let's jump into this. And as I said, I want to welcome you. I am a licensed clinician. I'm a full-time professor, and I teach graduate and undergraduate psychology and psychotherapy, and often will look at how to integrate models that seem to be wonderful in the treatment of particular kinds of conditions, those models that have high research support. So the overview of what I'm going to be covering today is, of course, one, what is ReBT? And I'm not going to go into great depth on that. If you want to know the basics of ReBT, you can look at my YouTube channel, and there are all kinds of free videos that cover different aspects of ReBT, and actually several that do an introduction, a comprehensive introduction to ReBT. So I highly recommend that you take a look at those if you haven't been exposed to that model. I'm also going to be looking at what is seeking safety, and then how do we integrate them. For those of you who don't know anything about ReBT, it's what we call a second wave behavioral model. First wave being behaviorism, second wave being ReBT, Rational Emotive Behavioral Therapy, and Cognitive Behavioral Therapy. ReBT that I'm covering today is a form of cognitive behavioral therapy that was developed by Albert Ellis, who was my mentor. I got to spend a good number of years working under him. And the model helps clients identify, challenge, and replace irrational, or what sometimes we call unhelpful beliefs that lead to both emotional and behavioral distress and dysfunction. Whereas seeking safety, wonderful model developed by Lisa Najavitz, is a present-centered form of therapy for PTSD, as opposed to an exposure-based treatment. And it's designed to address, as I said, both PTSD and substance use disorders simultaneously, without you worrying about exposing clients early on to memories of trauma. And this integration, I think, brings together the strengths of these two models, the precision of cognitive restructuring, or the changing of cognitions that we see within ReBT, into a safe, skills-built kind of setting that is established by seeking safety. So it's really, I think, a powerful integration. If we quickly look at the ABC model in ReBT, and as I said, I'm not going to be going into great detail on that. You can find that elsewhere on my YouTube channel. A stands for an activating event, something that happens. Typically, we look at activating events in the present rather than go digging them up for the past. Although, if the client is remembering something that had in the past, when they're experiencing particular emotions and behaviors, then that could be the activating event. Otherwise, the activating event would be the recent situation or event. And sometimes we talk about the critical activating event, which is even more specific. The activating event would be the general situation or the general event that is associated with the disturbance that the client is bringing into the session. The critical activating event would just be what part of that activating event is most relevant to the consequences that the client is bringing in. By consequences, we mean the emotions and behaviors that the client is bringing in and may want to change. So typically, they're going to be dysfunctional because those are the ones that clients will bring into session. The B would be beliefs, and that the individual holds about what? The beliefs that they have about the activating event. So the way we talk about this is that an activating event triggers something within us, within the client. And those would be beliefs that we have formed. We may have formed them way back in the past, but they're operative in the event now. And so those beliefs then are the more proximate cause of the emotions and behaviors that the client is experiencing then. Once we do that process with the client, identify the A, the Bs, all the beliefs, and the consequences, all the associated emotions and behaviors, the next part of the therapy is really about the treatment. DEF. D would be about disputing what? Those dysfunctional beliefs, challenging them. It's not an argument. It's not an argument. We're not arguing with the client about their beliefs, but we're helping them to realize the dysfunctionality of some of those beliefs. Not all, but some of the beliefs that they hold, in the hope that once they realize that they can begin to challenge it and then replace those with more effective adaptive beliefs, more functional responses. At the heart of ReBT is this ABC model. And as I said, the A would be the activating event or the trauma reminder. B is going, and we're going to be talking about the Bs, the typical kind of beliefs that individuals have when they're coming in with trauma and addictions, particularly addictions today. And some of those emotions that they also have, anxiety, depression, and of course the behaviors would be substance use in the case of addiction. And so we'll teach the client how to dispute those and replace them so that they can have more freedom and be more functional in their responses and better able to attain their desired life goals. Okay. So ReBT has what we call conceptualization of emotion and behavior. When we talk about emotions, we talk about positive emotions and negative emotions. Positive emotions tend to be emotions we like to experience. Negative emotions tend to be those we don't like to experience. However, among the negative emotions, there are those that are kind of healthy negative emotions and those that are unhealthy or dysfunctional. What we mean by that is certain kinds of negative emotions may tend to sabotage or hinder the client in attaining their desired life goals. And therefore, we would say that they're dysfunctional from that perspective. And then we will also look at the behavioral outcomes as a result of those beliefs that they hold and the emotions. So we distinguish between functional and dysfunctional negative emotions. For example, in the ideal vocabulary of ReBT, which the client doesn't have to use, it's just to help to get the client and the therapist on the similar page. we would say that sadness would be a healthy negative emotion. Nobody wants to feel sad, but it can be quite helpful. And then depression might be a bit a dysfunctional concern, healthy anxiety, not so much. And so often individuals who've experienced severe trauma and are in the throes of addiction operate from really extreme, rigid beliefs that lead to behaviors that are not helpful, like avoidance, aggression, or lapse or relapse. And so helping the client distinguish or understand the distinction between helpful and unhelpful negative emotions can empower them to kind of accept emotional discomfort without being controlled by it or driven by it. I do want to say, because some people go, well, it sounds like a semantic difference. Yeah, well, yeah, it's a semantic difference between healthy and unhealthy negative emotions, but it's far more than semantic. It's actually quite pragmatic because the dysfunctional emotions will tend to sabotage or inhibit, right, the attainment of those desired life goals, whether those are short-term goals or long-term goals, whereas healthy negative emotions may spur us to make some changes rather than to collapse in and ruminate and perseverate on those emotions and thoughts. Okay. And I want to look at common dysfunctional beliefs that we see in PTSD and substance use disorder. Certainly not exhaustive. I'm just going to give some examples as I move into the integration of these two models. One that we often see, particularly with substance use disorders, I can't stand this pain. Or with PTSD, I cannot stand this emotional pain. I must avoid all reminders of it, right? I must not get triggered. I'm utterly damaged. I'm permanently damaged. The old self is gone. I only have the dysfunctional self that is suffering and permanently damaged. Or using is the only way I can cope. And if I don't use, I'm going to feel awful and I'm going to be miserable to be around. So these are dysfunctional beliefs because holding these beliefs can inhibit the attainment of goals because you kind of collapse in on yourself. And these are ones that we mental health professionals typically encounter. Often we'll see, particularly in substance use, that is this belief that using is the only way that I can cope. Therefore, I have to use. And initially, maybe the substance was the way to cope with a very powerful negative emotion. We understand that. Some emotions are very, very painful, and that people want not to experience those. And so maybe they drifted into, they found out that, um, you know, opiates or weed or whatever it is may help them. But in the long run, it loses that effect, especially when they become addicted to it. So these beliefs are very rigid, they're absolutistic, there's no wiggle room here, and they're catastrophizing kinds of beliefs. These are what we classically would target within our EBT, and because they pragmatically interfere with moving toward sobriety. If you believe you absolutely can't stand the emotional pain without a drug, then you won't move toward sobriety, etc. It'll be extremely difficult to do that. Okay. So how do we, as I said, once we identify those beliefs, we don't rush to replace them. We want to help the client realize the dysfunctionality of those beliefs. Because if they realize that they're dysfunctional, they may not realize it, but sometimes they have some realization, but not sufficient realization. And so disputing these can be helpful. Um, there are different kinds of disputes, three main ones, but there are many, many, many. But I just want to talk about three of the most common ones. The one that we typically begin with is the pragmatic or functional dispute. And that's where we ask the client, is this belief, and we're talking about dysfunctional belief here, is this dysfunctional, unhelpful belief helping me reach my goals? Have them ask that question, right? First, we talk about what their goals are, and is this the belief that you're nothing without the drug or your damaged goods, is that helping you to attain your goals? Eh, What are you getting out of holding that belief? So we would challenge those. Um, the other kind of challenge is logical. Is this belief logical? Is it coherent with reality? Does it make any sense logically? Empirical is, what's the real life evidence that supports this belief? Is there any evidence, real life, that that supports that belief? For example, is it true that you can't stand this pain, or is it just very difficult to do it? Utterly can't stand it. So they may, okay, oh, that's a logical one, but maybe we need to challenge them in a different way. Has avoiding everything really helped you to feel safer long term and get things done? Is believing that you're utterly damaged leading you to healing, or do you just continue to experience more shame and guilt and dysfunction? So, this process, helping the client go through this process, helps them to build new, more flexible, less rigid, less judgmental, less global negative ratings of self, others, life, and world. So then we want to replace those emotions after we challenge that with different beliefs so that they begin to experience more functional emotions and behaviors. And I've already mentioned that some of the functional emotions would be like sadness, concern, uh, disappointment, remorse, maybe some regret. And functional behaviors would be assertiveness rather than the aggression, or passivity, reaching out for help rather than avoiding help as a result of shame, etc., or tolerating the discomfort, staying with the discomfort rather than going, I can't stand it, and immediately use. So once we have the client adopt healthier beliefs, then they experience more functional emotions, and those will lead to more functional behaviors. And like talking to a therapist, reaching out for help, maybe going to 12-step or a smart recovery group, practicing different kinds of self-care, eating well, getting a proper sleep, all of those kinds of things, and tolerating painful memories without using this substance. Okay. This is a process. This doesn't happen overnight. Okay. So if we continue, the next one is kind of, now that we have that kind of basic, quick introduction to ReBT, I want to say a little bit about seeking safety. There are YouTube videos on seeking safety. Just a few go into it in great detail or sufficient detail, but I do want to cover a little bit. I can't do full justice to it. I hope it's a teaser for you to begin to explore it yourself. And there will be follow-up videos in which I will look at how to implement the particular modules within this very powerful model for the treatment of both PTSD or other trauma-related disorders and substance use. It was developed by Lisa Najabitz, who had a grounding in CBT. She first developed the model for the treatment of women who have been raped, and now it is used not only for women but for people of all genders, and it is used for all kinds of trauma, including substance use disorder, which is not a trauma, but is often co-occurring. We often, two major co-occurring disorders with trauma tend to be major depressive disorder and substance use disorder. In fact, in my courses, and my students talk about why those would be likely co-occurring disorders. It is a present-centered therapy. It's not an exposure-based therapy. Exposure-based therapies would have the clients imaginatively go back to the trauma. Present-centered therapies do not do that. They help develop some skills to address when the individual is triggered and they're experiencing the emotional pain and dysfunctional behaviors. So it's more present-centered. Some thought is that the beginning with the exposure therapy for some clients may be a bit re-traumatizing. And there's considerable research for and against that belief, but that is a common belief, or that many clients just find the exposure-based therapies to be kind of emotionally pretty painful there. So dropout rate has been allegedly a bit higher with exposure-based therapies. Both are great. Both have strong research support for the treatment of PTSD. It's just a different approach, but almost similar outcomes. What's good about this model is it, as I said, it does address both the PTSD and the substance use disorders simultaneously. The old way of treating addiction was that we first, in PTSD or major depressive disorder, is you had to treat the addiction first. And once you do that, then you could treat the co-occurring anxiety, depression, whatever. Tend not to do that as much anymore. There are still some kind of old school approaches that do that, because often what we find is, let's say someone had an inordinate amount of anxiety associated with the PTSD, and they gravitated toward a substance use and developed an addiction to handle the really negative emotions and physiological responses, the hyperarousal and hypervigilance and all those kinds of things. And so if we treated the addiction first, then the addiction might be gone, but we haven't treated what drove the person to the addiction in the first place. So research suggests that it's probably better to treat them both simultaneously. Seeking Safety has 25 different topics, or what we call modules, and there's a listing of those within the manual that you can find. The manual is called Seeking Safety. You can get it on Amazon. It's pretty affordable. Last time I looked, it was about $65, somewhere around there. And there are 25 different modules. And you can adapt the models to your group. You can say, instead of using one model a week, I may spend 3 weeks on a particular model for this particular group. Or I may find, given that the mix of the group, I need to use one model before I use the other models. And that's okay. There are certain models that it's probably better to begin with, but these are not engraved in stone. So there's great flexibility in this model. So it is a present-centered model that emphasizes safety as a priority. What does that mean? Safety does not mean avoidance. Safety means safe in the way that you're thinking, having safe emotions, engaging in safe relationships, engaging in safe behaviors, so that you as a whole, complete individual are living out of safety. It is proactive. It is not avoidance. A lot of people with the trauma and addictions engage in avoidance, but that's not proactive and won't help make some major changes that we hope that they will make, so that they can have greater freedom and better attain a more full life for themselves, and improve interpersonal relationships and general enjoyment and freedom in their life. So again, it avoids any kind of trauma exposure. Individual participants are not permitted to go into depth. They can recall details of a past trauma. Instead, they build coping skills, or develop interventions and techniques to help them prevent lapse or relapse, and manage their PTSD symptoms. Again, these are flexible, and it's structured. It includes readings and workshops, and has homework, which they call commitment there. So it's a full kind of a treatment. It can be done individually or in group. I often like it done in group, because the connectedness of the individuals helps raise oxytocin levels, which can help knock out the effects of the cortisol, which individuals with PTSD and substance use disorder often have high levels of cortisol, which have deleterious effects over the long haul. I talk about that in other settings. Okay? So, what's the structure and the goals of seeking safety? Okay, I want to look at the goals first. Safety. Safety is the main thing, and I said safety in the way you think and the way you feel and all those kinds of things. Developing coping skills for particular situations, etc. Values clarification, which is tremendously important. It's better to develop goals if you know what your values are, so that the goals are consistent with your values and they're not working against them. And the other thing, which is essential for anybody that has PTSD or a substance use disorder, is building healthy connections with others. One of the worst things that can happen is for individuals to isolate, and that's common, right? In particular, PTSD, where they're making attributions of overwhelming threat in their environment, they may engage in avoidance and isolate. And the CDC has been very clear about the deleterious consequences of isolating and loneliness, that it's worse than smoking 2 packs of cigarettes a day, not engaging in exercise, and eating unhealthy uh, food and gaining significant unhealthy amount of weight. Okay, so those are the goals. The session format is followed. There's some flexible timings and all of that. First, there's a check-in. How are you doing? How are things going? But typically, they begin with grounding exercise. And Lisa Najavitz has a printout. In fact, if you go online, you can and you look up "Seeking Safety" grounding exercises developed by Lisa Najavitz. You can print off a PDF in which you can find those grounding exercises. And they initially begin with those because we never know the level of arousal that someone is at when they're coming into the group. So to kind of level the playing field is try to get some calmness so that people can, deal better and attend better cognitively and emotionally to the group. There's always a quotation. There's a reflection on that. There's going to be a specific topic discussion, which would be the module that you're covering. And then at the end, you develop a commitment. And I'll give you some examples of those in a minute. And then you have a checkout. So this is the basic structure. Typically, there are co-leaders of the group. It's easy to become a co-leader. You can get trained. It's just a one-day training to learn how to do seeking safety, and really well worth getting that training and have the co-leaders be trained. The reason you have co-leaders, there are many reasons, but one is, let's say someone gets triggered and physiologically aroused in the midst of the group, despite the fact that it's not an exposure group. Well, then you can have one person working with that individual. The goal is to help them de-escalate the activation enough so that they can return to the group, and yet the group can continue. So there is this consistent structure, and we've gone through the parts of it. The goals are quite clear, and they stick to those goals as much as possible. Okay. So let's shift to the integration. So I think that this is a perfect match to connect these two models, because both of these models emphasize the client building some resilience, facing the world as it is, accepting the self despite what they've gone through. So build the resilience and have some skill building that they have in the event that they get triggered at some point. I think of it this way, that seeking safety creates this kind of stabilization, this kind of wonderful holding environment in which you're going to learn some skills in a safe way. You're not moving toward the trauma, you're developing skills to deal with the consequences of that trauma. And then REBT will help deal with dysfunctional beliefs and help bring about transformation of healthy behaviors. Okay, so it's a really nice script. They're focusing on different things. The strategy is different, but the goal is pretty much the same in terms of what they want to help the individual build. So the other thing is it's very, very important, and I could have begun with this, but time-wise might have been prohibitive. And that is that the integration, when we're integrating this, that it should match the client's stages of change and readiness. I always like going to the stages of change that was developed by Prochaska and DiClemente. Excellent. And I've done some videos on that. And then also perhaps even motivational interviewing for looking at readiness and help moving an individual from one stage to another. So it doesn't take long to look at that stages of change of the individuals in the group, and then and see where they are, and we can screen for individuals up front. I'm doing another video that will talk about screening tools that you could use. I don't cover that in this one, but this is a good match. So REBT will challenge those beliefs, the unhelpful beliefs, because the unhelpful beliefs may sustain the PTSD and the substance use symptoms, and REBT can get to the core of the addictive behavior, what they're thinking about themselves and others and life and the world. It's a total philosophy of life that can be dysfunctional and needs some transformation, right? But we need to match the integration to the client's cognitive readiness and emotional capacity to engage in the work. So now I want to talk a little bit about how do we match REBT interventions to specific seeking safety modules. I can't do this for 25 different models, but I'm going to choose some of the models within seeking safety and show how we can pair the REBT interventions. And you can see, and I have another lecture that I'm actually giving at for a training treatment center in Connecticut on all 25 models and how we can intervene and connect them, right? So there's a model in seeking safety called honesty. And this module could, when we have an integration, REBT could target some of the beliefs that come up in the honesty module. So beliefs such as, if I admit the truth, I'm going to be rejected or hated. If I'm honest about what I've done and what I do in addictions and in my life as someone who is addicted to a substance, or someone who's experienced severe trauma and are now experiencing PTSD. So they may be afraid of admitting to others truth about themselves because they fear rejection. So they may hold the belief, I must hide my emotions or I'm just going to fall apart. I've got to be in utter control and not give in to emotions. So shut those down. Not great strategies, not really helpful beliefs, but very normal for people to experience. The integration of strategy here is use the REBT in this module to help challenge some of those shame-based beliefs that block being honest and transparent with others. Not that you want to blurt out everything in your whole history to everybody, okay? Interactions with people daily are not like a 12-step group, okay? So these things need to be contextualized. The other thing that REBT can help with is to introduce the concept, which is bedrock in REBT, and that is unconditional self-acceptance. We accept the self no matter what we have done, no matter what we have undergone, and no matter even the negative consequences, okay? to unconditionally accept the self. It doesn't mean you like everything that you've done. It doesn't mean that. It doesn't mean you like every aspect of the self. You may want to change the self in certain aspects, but you unconditionally accept that that is where you are as a human being. And we're all fallible human beings, okay? And we can learn to accept that. And so change that belief to I can tell the truth about what I've done, what what I've gone through, and I can still accept myself. That is a powerful place for people to get to because that is a bedrock of building resilience. So the homework in the seeking safety could be, in ReBT could be have a thought record and on emotional honesty and the feared consequences. It fits right in with this module. So as I said, we encounter some dysfunctional beliefs sometimes when this topic comes up, and then ReBT can help change some of those emotions by changing the cognitions. And when the individual is triggered, the wonderful thing that happens in seeking safety is they will give you some skills and techniques that you can use in this when this issue arises. Another one is coping with triggers. A wonderful module because I don't know any individual with either PTSD or substance use disorder that the issue is in coping with triggers when they occur. So the beliefs that may be common that in this module would be if I feel a trigger, I can't control myself. So I have to avoid all triggers at all costs. That's very difficult to do in life unless you live a very, very small, circumscribed life. And if you do, you probably won't get much enjoyment out of it, right? Or this memory means I'm still in danger and too weak to face challenging situations. I still have this memory that's very strong of what happened, and so I realize that I'm still in danger. I'm not really safe, and it's because I'm so darn weak that I just won't be able to face challenges. That will not help build the life that you want. It's absolutely normal. We understand that belief given what someone's gone through. But those beliefs, which may have been developed as a coping skill initially, are not real helpful in the long run. So the integration strategy here is help them learn ReBT disputing around catastrophizing or awfulizing, right? That belief. And then the other one would be the global negative self-rating. I'm weak, I'm broken, all of those kinds of beliefs that could get triggered in particular events. So the goal with ReBT in this situation would help to promote functional emotions, concern versus panic. Why? Remember that the functional emotions are the ones that will help an individual better attain their desired life goals. And the desired life goal here might be to obtain sobriety or more balanced life in the case of PTSD. We could also pair that with behavioral experiments. So, for example, staying in a triggering situation, triggering moment while practicing the grounding exercise. Okay, that if you're in a situation where you're triggered, do the grounding exercises rather than run from it and avoid it. Now, early on, you probably need to engage in some avoidance, but we want to move away from utter avoidance over time so that you can better face the challenge when you experience it and the consequent emotions, and that you will develop the skills to be able to better do that. Once you learn how to do that within ReBT and you use the skill set within seeking safety. Another one that is extremely important is setting boundaries in relationships. Often individuals who have been traumatized and are engaged and have substance use disorders may have some pretty leaky boundaries. And so, for example, if you're a substance user and you go back to the group of individuals or friends that you often used with, and you say, no, I'm not doing it, I'm just not doing it, then they're going to think you're bad, or they're going to think you're, who do you think you are? Do you think you're better than we are? And they're going to think I'm a bad person, and I will think I'm a bad person. All unhelpful beliefs. and maybe grounded in a belief, I've got to be liked by everyone. Okay. The integration strategy here is dispute that global evaluation. Being disliked by people doesn't make you bad. It means what? It says more about the person that doesn't like you than it does about you. So just because you're not liked or you're disliked doesn't mean you're bad. It just means that's what that one individual has evaluated you as, right? Does it make you wonderful if everybody thinks you're wonderful? No, it's just an evaluation that people have, and I don't have to embrace that. So what we want ReBT will help them do is practice unconditional self-acceptance, but also the unconditional acceptance of other people. Just as I myself am fallible, I've made mistakes, they're fallible human beings and they've made mistakes. And doesn't make them evil because of their mistakes. It makes them fallible just as I am fallible. The homework might be to identify and reframe those people-pleasing thoughts from recent interactions. Think about recent interactions where it was very difficult for you to say no, for you to say, you're working on sobriety, you're not using anymore, and you become real clear about that, right? Tell the truth and have a very clear boundary in the relationship. This is going to be something that many clients that come from a trauma history or repeated traumas struggle with boundaries because they may have these people pleasing beliefs. And this, what I like about ReBT is they separate the behavior that you engage in from your self-worth. We engage in behaviors, sometimes bad behaviors. We're not going to pretend that they're not bad, but they're bad behaviors. But that doesn't mean you're utterly without value. You are valuable and you can accept yourself, right? You can begin to respect yourself even in the face of disapproval from other people. Whatever they think about you doesn't make you whatever they think. Okay. Though that's a hard lesson learned, but with practice and in a group where people are practicing that together, it can be very, very powerful and life-changing. Safety. There's a whole module on safety that usually occurs pretty early in the group process. And the beliefs that show up, the ReBT target beliefs there would be, I can never feel safe again, having gone through what I've gone through. Safety has to be complete and perfect, and I have to be guaranteed safety or it's meaningless. Rather than, this is the integration here is the realization that this is absolute thinking, black and white thinking. It doesn't help. There's no such thing as absolute safety, unless you live a very small life and utterly isolated, and then you may not be safe there either. But dispute that and be safe enough, right? So that you can engage in the world with awareness and realize that some things aren't safe and some things are not as safe, that there's a big continuum here. It's not black, white. And develop some realistic, more flexible beliefs. I can do things to increase my safety, right? In the way I think, in the relationships I form, all of that kind of thing, without needing absolute perfection. And then actually beginning to do some visualization and rational emotive imagery. We envision what safe enough would look like and what it might feel like and how we can act into, our behaviors can help us act into living safely, but not perfectly. So catastrophizing about safety and embracing always and never, it'll always be unsafe. I'll never have safety. Those kinds of, I call that kind of false prophecy, and it doesn't help. It's like you can predict the world and the world is going to be utterly unsafe. It's big in culture right now. I'm seeing a lot of people thinking this way, right? That they're doomed to this perpetual danger. Now that their eyes have been opened, what their eyes have been open to is that they have experienced some really negative events and perhaps done some negative things, and people have done some negative things to them. But it doesn't negate that there's some safety in the world. Okay. And so we talked about relative safety rather than absolute safety. Safe enough. Okay? So it's open and adaptive rather than rigid. Another module is compassion, tremendous module. And because a lot of people, based on what they've done, what they've experienced, say, I don't even deserve compassion. I should be punished for what I did in the past. We often see this in military situations. In fact, one of the phrases they use for PTSD is moral injury because they've done things that may be against their values that they held, maybe their religious values or ethical values, moral values. And so they see themselves as utterly undeserving of any compassion rather than moving toward unconditional self acceptance, thinking that they have to punish the self, right? Here, ReBT helps by challenging those beliefs that give rise to guilt and shame, which are the global negative evaluation of the self. Teach unconditional self acceptance and unconditional life acceptance. Your life is valuable because you're alive. There's always hope. Okay. And so embracing that, not every aspect of life is likable, but it is valuable. What I like about ReBT is this phrase that I can have acceptance without approval, right? Others may not approve of what I'm doing, may not approve of what I've done. I don't approve of what I've done sometimes. But I can accept it and realize that I'm worthy of accepting the self and moving on and to develop a better life for me. I can dislike what I did without condemnation. Okay. So this will help. I like this module, and especially integrating with ReBT because it can help these individuals that are just engaging in self-hatred for no reason. It's understandable. It's certainly normal, but it's not helpful to live that way. Because I think often what happens is we ignore the context in which we ignore the context of the trauma and what we went through, and we just have the moral pronouncement about the self without looking at the context. And we always need to look at the context that helped, support or what we did that we don't like. So, so I think this is a really good interaction to help individuals move to self-forgiveness and forgiveness of others. Modeling healing from anger. Anger can be a major problem here, and often coming from beliefs that make sense but are not helpful. I must be treated fairly all the time. Well, wouldn't it be nice? Wouldn't it be nice if we lived in the world where we are treated fairly? The truth is, you're not going to be sometimes. And we can run around and feel angry all the time, or we can realize that we're treated unfairly and make some decisions about being assertive, about being treated unfairly and communicating not passively, not aggressively, and not passive aggressively, but having assertiveness so that you express that and your desire to be treated fairly, and you can make it very clear you won't continue to be treated unfairly. And so, or if someone wrongs you, that they're utterly a monster and you have to teach them a lesson, it's got to be a powerful lesson. I was talking to a client a few days ago that had that one in it, and it was just destroying the marriage, right? Because sometimes people do things that are wrong because they weren't thinking about you in the moment. They had other things going on, and they were addressing that, and there can be all kinds of reasons that people do things that are wrong. They may do it deliberately, but it doesn't mean that they're utterly contemptible and evil. So one of the homeworks is to track the situations that kind of provoke anger or trigger it, and then apply the cognitive reframing to get some more adaptive ones so that, we're in, that we're really annoyed and powerfully annoyed with them, and that we may have consequences, and we may even decide we don't want them in our life. But we don't have to live with that anger and let it rent space within our mind, right? Okay. So next is recovery thinking. Powerful. In REBT, what we often see, and in the group seeing safety, some people come in and they go, if I lapse or I relapse, I am a failure. I tell my clients, you don't have the luxury of embracing that unhelpful belief, because here's the dynamic there. If you say, I'm not going to use, I'm not going to use, I'm not going to use, and you use, then you go, oh my God, this is proof that I'm weak, that I'm no good, I will never change, the world is horrible. And you keep going over that. You ruminate on that belief over and over and over again to the point it's almost perseveration. Then what happens is you feel so emotionally distraught, you're isolating, and you're not having any enjoyment in life, no pleasure. Then you go, there's always one thing that makes me feel better. And guess what it is? It's a substance. So I say, you beating up on yourself because you lapsed or you relapsed is the next step toward maintaining that relapse, right? Or returning to a lapse or relapse. You cannot afford that. What will help you is to say, I lapsed, I relapsed. Wish I hadn't done that. Wasn't a great thing. Doesn't make me a complete and utter failure. It means I'm a person who made a mistake, made some unwise choice, whatever, right? And use it as a learning experience to move on. So, or recovery should be onward and upward with no movements backward. Well, very few things in life are onward and upward. If you remember when you took a calculus class, you thought you got it. It's not onward and upward, it's moving forward and setback, moving forward and setback, And that's often the case with any condition, including PTSD and addiction, okay? So REBT can help with disputing that perfectionism, that black and white, all or nothing kind of thinking, again, by introducing unconditional self-acceptance, and then have goals that are focused on the process getting better rather than focusing on the end, okay? We want to help move in the process, and we do that by having short-term and intermediate goals, not just the long-term goal of sobriety, but intermediate goals. And because the attainment of those short-term and intermediate goals helps in the production of dopamine. And dopamine for me is another word for motivation. If we get a shot of dopamine, that helps motivate us. So we do that, and as we're striving toward those short-term goals, we better move toward maintaining the movement toward the long-term goals, okay? So, and then finally affirm that lapses and relapse are just data. They're not destiny. They don't predict your future. It's just a setback. It's a learning opportunity, so you can refine the beliefs and behaviors and do better as you move on. Okay. Now, the creating meaning module can be pretty helpful. It's a very powerful one. And actually, toward the end of therapy with PTSD and some of the old treatments of PTSD, and even now, is the individual is going to need to create meanings. The meaning may have been broken or lost due to the trauma or some of the negative aspects of substance use disorder. But the beliefs that we see here is that my trauma defines me. I am my trauma. In fact, I don't have depression. I am depression. I don't have anxiety anymore. I am walking anxiety. We have our friends in acceptance and commitment therapy, a third wave behavioral model, excellent model, says we've fused with that. We've fused with the thought, right? We've fused with this belief about the self rather than realize we're a person in process. We are in process. No one event defines our being. We're complex. We engage in too many things daily to choose out one thing. to say this defines me, especially a trauma. And or a belief that there's no purpose in my suffering. You know, you went through suffering and you can find purpose and meaning in the midst of the suffering, not that you want to maintain the suffering, right? I often tell individuals I'm a cancer survivor, and I remember when I had cancer and I was going through it, um, people, I was thinking that, that this is just suffering and it's all about suffering in the midst of it. Like, wait a minute. I don't I don't want to suffer. I didn't want the pain, but I am going through that now. But I'm not defined by the pain that I'm going through. In fact, after that, I decided I didn't even want to see myself as a cancer survivor because now I'm just choosing one event as the most significant event in my life. I'm not saying that that's wrong for people to identify as cancer survivors. That could be really adaptive and helpful for them. For me, it wasn't because I didn't want any single event or series of events to define myself. Okay. And so challenge those self defining beliefs and existential nihilism that, yeah, there's no purpose or meaning in life because you can create your purpose and you can create your meaning, right? Explore how those beliefs shape your identity and your values. Get back to those values. And you can assign some ReBT reflection on what values can I act on despite my past trauma. Let's say my value is justice. How can I act to create justice in the world despite the fact that I was treated unjustly? So tap into the value and work on behavioral exercises to do that. And so this can be really transformative to individuals. Move from I am my trauma to I am a person who experienced trauma and I decide what that means to me. That's powerful. That's developing a new kind of philosophy of life. I'm going to summarize the integration. Here's how I look at it. You may see it differently, and I would love to hear from you if you see it differently, and I'll share that. You can do that in the comments, or you can even do it on the video in YouTube in the comments section. And I would love to hear from you. I respond to those. And so here's how I view it. And I see seeking safety as this safe holding environment because we're not going to sit around and talk about just the trauma. We're going to work together on creating skills to address it when we are experiencing the emotional and behavioral consequences of that trauma. We can apply ReBT to develop awareness of what we're thinking, and especially the dysfunctional thinking that may maintain some of the symptoms that are tremendously powerful and the behaviors that don't help us move forward in life in a more enjoyable life. We can learn how to dispute those beliefs and then replace them with new beliefs. So, and the other one is to match the ReBT interventions to the client's insight, the topics and the readiness that we experience, and also to the topics that are included in seeking safety. There are 25 modules. As an ReBT therapist, I go through each of these models and go, oh, wow, that makes sense from an ReBT perspective. So it's easier integration. Sometimes this integrating ReBT into seeking safety allows for maybe deeper emotional and cognitive change, but seeking safety has this emotional and behavioral framework that can be wonderfully supportive for them. And both together can help move individuals beyond what I call a threat saturated or a pain saturated self narrative. What does that mean? Many people who have experienced PTSD, many people who have engaged in addictions, who have experienced addictions for a period of time, have a narrative in which a story about the self where it's just filled with trauma and filled with pain. We see the threat, but we fail to see the resources that exist within our environment. To see threat and threat only is to see threat as overwhelming. But if we move toward manageable threat, which seeking safety and RBT can help with, we do recognize that there's threat in the environment, but not everything is threat. And why is it not threat? Because there are real resources within our environment. And from an evolutionary standpoint, one of the biggest resources that we have is connection with other people. So, the biggest resources to help overcome some of these things is that you connect with yourself and the self that you want to be and you hope to be in the future. You connect with your values, the deeply held values. And some of those you may need to develop, and experiment with in time. You connect, of course, with other people. Maybe you connect with God or a higher power or something like that. All wonderful ways that actually increase oxytocin within the body, and oxytocin helps to negate the effects of cortisol, so that has health benefits not only physically but emotionally. Okay, so this, I think, the integration creates wonderful opportunities for deeper insights, healing, and kind of empowered action. For me, empowered action means resilience, that you are able to be resilient when the negative things happen. And negative things will happen um, for all of us. Okay. So homework and commitment. Um, this is really important. Thought records, belief disputing, behavior experiments, and acting on new functional beliefs, seeking safety. You can have like daily practices, affirmations, skills that you're doing, so you can combine these. And so, combined example might be from an RBT perspective, complete a thought record on trauma related beliefs, dispute them, and try to practice replacing them. Whereas the commitment within seeking safety could be practice one coping skill. Maybe it's cognitive restructuring when I'm triggered this week, or one of the coping skills that they have. Ride the urges rather than giving in to the urges. Okay. So there are all kinds of things, ways you can integrate the homework assignment of an REBT with a commitment there. I'm working on a group that's going to be coming up. And one of the things I'm going to be doing is having a manual that the group members create themselves, and they look at commitments, they try things out, and they talk about the consequences of it, and they share that with others. They don't have to write their name on it if they want to initial it or something like that, or just leave it anonymous. And they build like a resource module for each of them to help each other as they're going through life. It can be a powerful kind of thing. There are some challenges to integration, different pacing, different goals. The focus is different for REBT and the present-centered skills in seeking safety. Otherwise, they would be the same group, but they're not. Same thing. So, and sometimes with a dual focus, clients may see that as overwhelming. But so there may be some challenges to it. And so cognitive restructuring may sometimes clash with seeking safety's emphasis on stabilization. It doesn't have to be, and I think we'll talk in a minute about ways that we can do this. They may feel overwhelmed in the balance between the belief work and the safety skills. And so this is why it's really important to look at the level of readiness of an individual to take this on, and not to push for too fast for cognitive restructuring when maybe stabilization hasn't been established real well within the group. Okay. So strategies to overcome these, I think, use the seeking safety to help build the readiness for REBT in the early part of the treatment. I think they can work really well together there. Okay. Holding environment, although REBT can be a holding environment too, it is the structure of the seeking safety and the group aspect of that can be really, really important. You could have an REBT group, which gets similar kinds of groups, but the focus would be a little bit different. And I think it's nice to start with belief awareness on the clients before we begin with full disputing. Become aware of the beliefs and the consequences of your beliefs before you begin to dispute them. Awareness would be really, really important. Also, co-facilitate groups with different foci, right, or focuses. Um, so maybe you have an REBT group that's really aware of what's going on in the seeking safety group. And so you kind of integrate it, but the process of in the one group is a little bit different than the process in the other, but they're supporting what they're learning in each of the groups. That could be extremely, extremely powerful. And then adjust the homework to the client's capacity to do that. Okay, so stages of readiness that I talked about initially. Summary. It's my opinion, and I've worked in this area, is that REBT and seeking safety can be highly compatible. I do think that the REBT can bring a precision to the belief work, but seeking safety provides this wonderful supporting structure and stabilization, the safety component. So I think this is a very powerful integration, and together they offer this comprehensive pathway to recovery and to get them better connected with the self, others, life, and the world so they get more freedom and enjoyment of life. So let me look at this. Before I go to this slide, there was a question, and that is they said, how would a client be shown how to juggle seeking safety and community while managing people-pleasing tendencies due to past trauma? This is an excellent, excellent question. And I think one of the things that the REBT component can do is to become aware of the beliefs that lead to people-pleasing and make that aware that that's one of the commitments you're doing, and ask for feedback from others and say, because normally we don't give feedback unless someone has asked for it, and then we can give feedback. So don't jump in and give feedback unless somebody's requested it. But so we've discussed how to seek safety. For example, we may gradually share some things about the self. We take measured risks in terms of what we share, but we're also aware that we don't share sometimes, even take small risks to share because we think it will be awful if others don't approve of us. So we might hide any negative. But the trouble with that is then we don't get the joy of experiencing, wow, I took a risk and the world did not collapse. Maybe I didn't like something that someone said, maybe they're having a bad day or they're dealing with something. So I think the using the REBT cognitive restructuring, the awareness of that while they're working on safety in the group and doing that with the skills building. So thank you so much for that question. It's really good. And you're absolutely right. I love that you use the word juggle because that's the reality, right? We want them to learn that this is not black and white. We're juggling this, and maybe the juggle won't be perfect, but you're going to move toward, taking some risk, and that you grow, and that the others around you are going to be growing too. Again, thank you so much for that question. If anybody else has any questions, then I'm certainly happy to do that. If not, again, thank you so much for coming. And if you did find it helpful, I do always appreciate making a comment to share your thoughts and questions. You might consider subscribing to the psychotherapy education and and training YouTube channel, because we have more free for more free content that I give to members. I go into much more depth every month, special workshops that go beyond this. This is a free workshop. Go beyond this, monthly integration webinars, advanced skills training. And I'm having one group that will be international coming up pretty soon, where individuals who are practicing ReBT will actually be able to get supervision at a really, really affordable price. I think member is like $6.99 a month, and getting supervision at that rate is amazing. And the other thing is you'll get early access to new content that comes out before anyone else gets it. So yeah, please consider that, and hope this was enjoyable to you. And again, thank you for taking time out of a busy Friday to be with me. I do appreciate that. And um, just have a great day. Bye bye.